The very best DJs from all around the world, playing music from the 60s, 70s, 80s, 90s, and the best hits of today. Sounding good. SG1 Radio.
You're listening to SG1 Radio right here, right now with me, Naz, taking you up until 4 o'clock. And it is time to welcome our first guest, who is here to talk about the vaccine take-up in Stevenage and across Hertfordshire. So can we please welcome Dr Kolade Daodu, who is a general practitioner and a clinical director of Stevenage South Primary Care Network. How are you doing?
Good afternoon, Naz, and all the listeners on SG1 Radio. I'm doing very well, thank you. Thank you for having me on your show.
It's an absolute pleasure, and thank you so much for taking out the time to speak with us here today. So, Dr. Daodu, how has the vaccine take-up been in Stevenage so far?
Yes, I'm pleased to say that the majority of the at-risk groups in the government initial stage of the vaccination rollout are seeing very good uptake within Stevenage. We're looking pretty good at about 90% in the over 70s, which are the patients that are most at risk that we are trying to protect the NHS from. And we are hoping that the penetrance, the uptake, would increase in that same manner going down the ages.
That's interesting. And I think it's quite good as well that we're going through that quite well. And I know some of my listeners especially, they've been quite worried about the vaccine, particularly as it was made in a shorter amount of time when compared to previous vaccines maybe. So in your opinion, how safe is it?
Yes, I just want to reassure all your listeners that the government has taken all the appropriate, precautions to make sure that these vaccines are not only safe, but they can assure the quality and the efficacy as well. They've, released all the studies in the public domain for the 3 currently approved vaccines, and I'm very, very confident in the science behind all those studies. If you may permit me, I just want to summarize the reason and the rationale behind why these vaccines have been, so quick to come out to the public. We all know we're in a pandemic, therefore everybody across the world has been, focused on this effort with a laser focus. All the governments have pumped in a lot of funding, all the scientists, the doctors, the researchers, etc. They've all worked together fantastically over the last 12 months to make sure that we are where we are in this fight against COVID. So traditionally, when you're trying to develop vaccines, there'll be lots of bureaucracy, there'll be lots of funding requirements, there'll be lots of checkpoints and stages before it comes to market. All these were going on simultaneously at the same time, rather than waiting for each stage to be complete before the available data is given to the regulators. And that's why we were in that very comfortable position in December when we were given the green light by the MHRA to carry on with the Pfizer vaccinations, and we've had such amazing progress ever since.
No, I think it's great as well. And am I correct to think that now over 50% of the adults in the UK have been vaccinated, which is we're doing quite well, I have to admit.
Oh yes, that's right. And I just want to put a point of of focus. That's the first dose. Close to that amount I've gotten the first dose, and that's quite remarkable. Thinking of where we are last March when this pandemic broke out.
Yeah. So how do the vaccines work on our bodies?
Okay, so basically vaccines make your body produce an antibody response. What we call an antibody response, just a kind of protection mechanism, a defense mechanism against any kind of infections. And the currently, authorized vaccines for COVID in the UK produce antibodies to a part of the COVID virus we call the spike protein. So that's all what the vaccines are doing. The vaccines are not injecting you with any coronavirus, and you're going to get any coronavirus infection once you're vaccinated. All your body is doing is stimulating a response, a defense mechanism to that part of the virus, so that whenever in the future it comes in contact with a part of that virus, it knows how to defeat it. And basically that's what the vaccination, does in the body.
That's really interesting to hear. And what kind of side effects can we anticipate with the COVID-19 vaccine? Because I know I've been speaking to a lot of people and everyone has had very different responses. But in general, what are the general side effects that we should be expecting?
Yeah, side effects, will vary from person to person, just like you rightly said. The most commonly, associated side effects with, vaccinations will be pain at injection sites. You can have perhaps, tiredness, aches and pains, chills, a fever. Some people will have a headache, nausea. All this improve in the first few days, and some people might choose to take some paracetamol, fluids, rest, etc. If it does persist after that, anything after 4 days, then you want to be contacting your healthcare professional to make sure there's nothing more that they need to be looking into.
Yeah, and is it safe to get the vaccine whilst you're pregnant or breastfeeding?
Yes, that's a very good question. Thank you so much for that, Naz. There's been no evidence that the vaccines, the currently approved vaccines for COVID in the UK are unsafe. However, I want to qualify that by saying that the vaccines were not intentionally tested in that age group, but there's now an emerging body of evidence as some pregnant women, breastfeeding women choose to take the vaccines. That would give us the opportunity to get more and more data about its effects on breastfeeding and pregnancy. But for now, the advice is, each breastfeeding or pregnant woman needs to have that individual conversation with their healthcare practitioner to make sure that the benefits of that vaccination outweigh the unknown or unwanted risk with either pregnancy or breastfeeding. But the current guidance is that there's no evidence to show that it shouldn't be given in those groups of women.
And have there been many pregnant and breastfeeding women being vaccinated so far?
Well, I won't say many, but there have been some. Okay, and like I said, that evidence will keep growing and growing as more and more women choose to have the vaccination.
Okay, no, that's interesting to hear. And what age category and priorities are they doing now at the moment in Stevenage? Because I think last time I heard they were doing plus 40s and moving on to maybe plus 30s soon.
Yes, that's a very good question. This keeps changing depending on the government, on the JCVI information. Currently, we're in phase 1 of the program, which is what we call cohorts 1 to 9, and those cohorts will be the first cohorts are that we did back in December. We started off with cohorts above 80, people that were in care homes and the care staff that were involved with them. Then we went down to cohort 2, which were people that were healthcare professionals and social care workers. And then we started going down the age groups, over 70, 75, etc., until we got down to over 50. So everybody basically over 50 now should have been offered the vaccination. Everybody over 18 will have any kind of what we call clinically extremely vulnerable characteristics or medical conditions. Anybody that has any kind of healthcare condition that puts them at the clinically vulnerable group, people with learning disabilities, etc. All those groups of people above 50 and including above 50 should have been vaccinated within Stevenage by now.
Yeah, that's interesting. And there was another point I wish to raise, because I know a few of our listeners have raised it as well, about side effects, noting that elder people have experienced less side effects compared to younger people. According to you, is this something that's more likely to be expected?
Yes, because of the characteristics of the immune system as you grow older. So the nature of the vaccines and how they're developed, the way they are delivered to generate that immune response might vary from age group to age group. So I think the trend that we are seeing is the younger you are, perhaps the more your immune system wants to build that, mount that response, and wants to show that it's mounting the response. But in the elderly age group, it's still mounting that response, even if, and in some cases even higher than younger age groups, but perhaps they're not showing that much evidence in terms of symptoms. Okay, so it's just the characteristics of the older to the younger age group and how their bodies mount and display, more importantly, display that immune response is the difference that we're seeing in perhaps some of the listeners.
Okay, and another question I had as well, I don't know if it's true or if it's a myth, but if you experience side effects, does that mean that the vaccine is working on you? Or because a few people think if I'm feeling very ill, then surely it's working on me.
Yes, in the first, I would say, couple of days, it's not uncommon for you to have side effects, and that is usually a marker that your body's mounting a response. In younger people, that's why I'm trying to be clear about that. But in older people, in the studies, it's still mounted even a higher response, but possibly with less of those effects being noticeable.
Okay, no, that's interesting. And recently, there's been quite a few speculations of the AstraZeneca vaccine causing blood clots. What are your views on that?
I mean, my views are, reflected in what the Joint Committee on Vaccinations and Immunizations, in conjunction with the Medicines, Health and Regulatory Authority, have released, and that is that the benefit of the AstraZeneca vaccine will still outweigh the risk in majority of people that are going to be taking it. Now, I want to classify that. The majority, perhaps we need to look at the population risk and the age profile. Okay, we know that some of these side effects and reactions are much more much more evident in the younger cohorts, and perhaps that's why the advice came out a few days ago after they've analyzed all the data, that perhaps for people aged 18 to 29, because of an abundance of caution, we should perhaps offer them an alternative. Okay, because perhaps in that age profile, if we have options that don't give you that same risk profile, then it's sensible and safer to go with that option. And that's why I want to still advise people to still please have your second dose, especially of the AstraZeneca, if you've had the first dose, because this evidence is strictly, and guidance is strictly for patients that are yet to have the first dose of the AstraZeneca vaccine. For people that have had the second dose, this clotting risk is an increase. Therefore, the guidance is to still have your second dose of the AstraZeneca if you've had your first dose.
Okay, that is quite interesting. What you mentioned as well about the government guidance saying that the 18 to 29-year-olds will not be having the AstraZeneca. But what about those who are in that age category who've already received the first dose of AstraZeneca, and including my own sister as well? Will they be given another brand for the second dose? And if so, will there be any problems of mixing and matching the different vaccines about?
All right, that's an excellent question, Naz. The guidance, like I said earlier, is for first doses only. That's the evidence base that the government authorities have reviewed, and they've possibly reviewed the evidence in the second dose as well, and they didn't see that relationship. And that's possibly why they've advised that for those people who already had their first dose of the AstraZeneca, even in that age cohort, they are still safe to have the second AZ dose. Okay, so I want to be very, very clear about that. Now, going to the questions of mixing and matching, the recommendation is not to mix and match if it's at all possible, because the guidelines for the authorization of these vaccines were based on the data using the same doses. However, if there are exceptional circumstances, for instance, when you can't get the first dose again, the manufacturers just maybe stop producing it, there are shipping problems, etc., or someone's from abroad from holidays, had his first dose, doesn't remember what the first dose is, there's no record of that, or if the person has had a severe allergic reaction known as anaphylaxis to that first dose, then he wouldn't be recommended. You'd have to use an alternative vaccine. So normally I would say no, you shouldn't mix and match, but there might be circumstances and situations where it will arise.
Okay, no, I thought I would definitely ask it because I know it might relate to some of the listeners, and it definitely relates to my own sister as well. And while you're here, I thought might as well take advantage of having to be able to ask these questions. But no, that is quite interesting, and also with the guidance that after the first dose, you must take the second dose within 3 months. What happens if, for some reason, these 3 months expire? Like maybe there is a vaccine shortage and they aren't able to supply the second dose within the 3 months. What would happen then? Would that person need to go back and have the first dose again?
Yeah, that's a very good, technical question. It depends on how long in between the recommendation for that second dose the delay is happening. If it's still within about a week to maybe another 10 days, it's still acceptable. If there's, however, a longer delay, because we don't know how long these vaccines last for the protection after the first dose, we don't know the infinite number it lasts for, you might have to start the whole dose again. There will be guidance coming out shortly regarding those scenarios, but the current guidance is it can be given between that 4 to 12 week period, and there should be a bit of leeway possibly after that, but the longer you leave it, then possibly the lower the immunity might be, so you might need to start all over. It will vary from vaccine to vaccine that's available. Clearer guidance will be available, but in the UK and in Stevenage are in such a very good place that all the second doses are occurring well between the 12-week period.
Touch wood, and it continues to be like that, because I know a few people are a bit worried about, again, the media speculations that there is a bit of a vaccine shortage. Is that correct? That there is a vaccine shortage?
Yeah. Thank you, Naz. I think that is a question that I would want to leave to authorities higher than myself. In my center, we have enough vaccines for all the patients that are booked in. And I think the good, place we find ourselves in the UK is we've possibly ordered a bit more than we could need for the initial courses and initial stages of the program. So even if we did have a shortage of one particular vaccine, we should have coming on stream more of another. For example, Moderna vaccine that we rolled out last week. It started, so I wouldn't be surprised very soon if my center gets a dispatch of Moderna in the next week or two. Even if AstraZeneca is short in supply. So the UK has done fantastically well in making sure that this vaccination program is rolling full steam ahead.
No, I'm quite glad that it's going that way as well. And there's also been obviously a few, I don't know if it's a myth or true, that some people are thinking that if they've had COVID once, they won't get it again. So a few are querying if they've had COVID before, and there's very minimal chance of them getting it again, if that is true, would they still need to be vaccinated?
Yes, that's a myth. It's not correct. So if you've had COVID, yes, you'd have some antibodies, depending on exactly when you had COVID, will determine how long those antibodies last. The jury's still out. We're not really sure. And in addition to that, you could have a different strain of COVID infection. That means that the antibodies you had to that initial infection don't, cover you for that new strain infection. So the advice by, the government authorities is, even if you've had COVID, you should give yourself at least 4 weeks and still book in to have your full course of vaccination.
And also with the vaccinations as well, again, a few of my listeners have queried this about being told that we would still need to wear masks, we would still need to maintain social distancing even after being vaccinated. Are you able to explain why, please?
Yes, that's a very good question by your listeners. The reason, because we don't yet know exactly how much of the vaccination stops transmission of the virus. There's very clear data about how much it stops infection of the person. Okay, so yourself, there is evidence that you'll be close to 90%, safe from severe infection, for example. But for your next person next to you, if you are not wearing a face mask, not social distancing, we don't know that percentage yet. So that's why the current advice is, even after your full vaccination, stick to the government guidance, keep away 2 meters, wear a face mask, wash your hands, make sure you're in a well-ventilated area, to reduce the further spread of transmission.
No, I think that is really great, great advice as well. And I just want to say thank you so much for joining us here on SG1 Radio as well. It's clarified a lot of concerns and queries our listeners had. And yeah, taking out your time on a Saturday as well. I really do appreciate it. Anything you'd like to say to our listeners? Any words of reassurance for them?
Yeah, I just wanted to reassure listeners that yes, the vaccine program is rolling out smoothly in Stevenage and Hertfordshire. Thank you so much for everybody that has been spreading the good word. You've been going for your appointments. We still want to reach out more to people that perhaps are still a bit more hesitant, not as confident as others. There are wealth of information about the vaccine program. Check on the gov.uk website, nhs.uk website. We're partnering with community associations like the Stevenage World Forum, Afro GP Hertz, and there's a pop-up clinic, a local vaccination clinic we're starting to run now. The first happening in Watford, WD189QD at the Hollowell Community Centre. Runs from 10 a.m. to 1 p.m. If you're in any of those groups that we mentioned earlier that's eligible for the vaccine, take yourself down there. You don't need your NHS number. You don't need any ID. Just take a name and date of birth. You will get a vaccine. We're going to be running some of those clinics in Stevenage as well very shortly. If any of your listeners have any questions, feel free to use the Afro GP Hearts and Beds question line. That's at COVID-19 at afrogp.co.uk.
Thank you so much. It has been an absolute delight to have you here, Dr. Daodu, talking about the vaccine. And yes, please do keep us updated with any information you have so we can also update our listeners as well.
I will now. Thank you for helping us work together to defeat COVID-19.
Yes. Thank you so much. Take care and have a lovely weekend.
And you too. Thank you all, everybody. Bye-bye now.
Bye. It has definitely been a pleasure having a medical professional telling us about the COVID vaccine. So if you have any concerns, please do get in touch so we can relay any information. And yes, today is my last show until 1 month because I'll be off, but I'll be back again the following month in a month's time. But until then, do stay safe, take care, and I'll be finishing off the hour with a very beautiful rendition of Anyone by Justin Bieber, and it is Na Ho Tum To in the vocals of Ranit Shale and music by Agrim Ganti. And see you guys very soon. Take care. Bye. मैं भी दिल भी है ये जान भी सांसें